Stroke warning signs can vary from person to person, and they can occur suddenly or develop gradually over time. Here are 10 common warning signs of a stroke. Sudden numbness or weakness. You may experience sudden numbness or weakness, especially on one side of your face, arm, or leg. This symptom is often one of the first signs of a stroke. Confusion or trouble speaking. You may have difficulty speaking or understanding speech. You may slur your words or find it challenging to express yourself clearly. Trouble seeing. Sudden blurred or decreased vision in one or both eyes can be a warning sign of a stroke. You may also experience double vision or have difficulty focusing. Severe headache. A sudden, severe headache that is different from your usual headaches can be a symptom of certain types of strokes, such as hemorrhagic strokes. Dizziness or loss of balance. You may feel sudden dizziness, loss of coordination, or have difficulty maintaining your balance. Sudden trouble walking. You may experience sudden difficulty walking, stumbling, or feeling unsteady. This can be accompanied by a lack of coordination or a feeling of weakness in your legs. Facial drooping. One side of your face may droop or feel numb. Sudden onset of a severe or unusual headache. As mentioned earlier, a sudden, severe headache can be a warning sign of a stroke, particularly if it is accompanied by other symptoms. Difficulty swallowing. You may have trouble swallowing or feel like something is stuck in your throat. This can be a sign of a stroke affecting the area of the brain responsible for controlling swallowing. Sudden confusion or difficulty understanding. You may experience sudden confusion, have trouble understanding what others are saying, or have difficulty comprehending written words. Are there any risk factors that increase the likelihood of having a stroke? Yes, there are several risk factors that can increase the likelihood of having a stroke. High blood pressure, hypertension. This is one of the most significant risk factors for stroke. High blood pressure can damage blood vessels and increase the risk of a blood clot or rupture. Smoking. Smoking can damage blood vessels and raise your risk of stroke. It also contributes to other health conditions such as heart disease and lung disease, which further increase the risk of stroke. Diabetes. People with diabetes have a higher risk of stroke due to the impact of high blood sugar levels on blood vessels and the increased likelihood of other risk factors such as high blood pressure and high cholesterol. High cholesterol. High levels of cholesterol in the blood can lead to the buildup of plaque in the arteries, narrowing them and increasing the risk of a blockage or clot formation. Obesity and unhealthy diet. Being overweight or obese, especially when combined with an unhealthy diet high in saturated fats, cholesterol, and sodium, can increase the risk of stroke. Physical inactivity. Lack of regular exercise and a sedentary lifestyle can contribute to other risk factors such as high blood pressure, obesity, and diabetes, thereby increasing the risk of stroke. Excessive alcohol consumption. Consuming excessive amounts of alcohol can raise blood pressure levels and increase the risk of stroke. Atrial fibrillation, AFib. AFib is an irregular heartbeat that can cause blood clots to form in the heart. If a clot travels to the brain, it can result in a stroke. Family history and genetics. Having a family history of stroke or certain genetic conditions can increase the risk of stroke. Age and gender. The risk of stroke increases with age. Men tend to have a higher risk of stroke than premenopausal women, but after menopause, the risk in women catches up due to hormonal changes. Remember, if you or someone around you is experiencing any of these symptoms, it is crucial to seek immediate medical attention. Time is critical in the treatment of stroke, and prompt medical intervention can significantly improve outcomes. I hope you find this video useful and you enjoyed it. If you liked it, give it a thumbs up, and don't forget to subscribe to our channel.